and I'll open this up to the panel, but my initial concern is I've seen kids who, for lack of a better term, glasses abuse, right? Like they don't wear their glasses correctly, or they get damaged, or in a lot of cases, they're not wearing them to boot. So I'm wondering about the compliance concerns. And I'm curious to see, or hear what the other panelists have to say. Tiffany, let's start with you. What are your initial concerns about this particular aspect?
I that point got brought up to me. I was talking to Justin about this, Justin Kwan, and I think that I think how you educate your patient is going to make a big difference. So there's a big risk of non-compliance for atropine, but my patients are usually pretty compliant. And I think maybe because we keep a close eye on them, so we see them at least every 3 months, if not every 6 weeks, just to kind of check in, to check their axial length, to see how they're doing. And I think that check-in helps to keep them more compliant. I also always tell my parents that if the kids aren't wearing their glasses, they're really good at communicating, but they usually do it non-verbally. So if they're taking their glasses off, to me, that tells me that the glasses may be not the right tool and we need to think about something else. So that's kind of my thought on if they're not wearing the glasses. Well, let's get back to the drawing board and see why they're not wearing, because especially a myopic kid, if they put on glasses, they should see way better. So to me, that seems like they would want to wear their glasses.
Mm-hmm. Yeah. Grant, I once sat in on with a patient, 15-year-old kid, and his mom was still putting in his ortho-K lenses for him at night. And I was shocked. But the fact remains that the kid was, the opposite of compliance, I guess. You work all the time with kids that really, really struggle oftentimes with INR. And I've watched you just, time after time, patiently sit with them, work with them until they eventually get it. Is this going to be a game changer, having a glasses option for those kids that are just not able to, get ortho-K?
Yeah. And that's part of the fun and excitement here is, as much as all four of us here would love to fit ortho-K in every single patient, sometimes it's tough and, and you give up, and what do you do? Well, here, let's try to put a bigger soft lens on. That might be more challenging. And then it's like, well, let's beat the front surface of your eye up with atropine for 2, 3, 4, 10 years. And so this is, again, I just go back to, this is easier. And, easier is not always best, but when you have those patients that you get that read on, if I can make it easier on them, hopefully that's easier for compliance and success of treatment.
If you're interested in getting the rest of the episode, consider becoming a paid supporter of the Myopia Mindset. In addition to an extended version of this episode and every other episode that we do, you'll also get access to exclusive monthly bonus episodes of the Myopia Mindset. And I know you're interested. You've made it this far. You can do so on our Substack, myopiamindset.substack.com. I'll see you at the next one.